Yes, anytime, anywhere through the recorded sessions. Then also we provide notes that are basically ultimate comprehensive book with CBME based question answers, MCQ, and full zone assessment for the students. And then also we provide MCQs that are basically from beginner level to expert level, that consist of standard level of MCQs. Then you can also book a personalized session in which there will be direct interaction of the counselor with the student. Then we have some subscriptions plan for basic 3 months. It is for 15,000, but the services will be included only pre-recorded classes and live classes will be there. For standard 6 months, it will be 30,000, and in which includes pre-recorded classes, live doubt clarification. Then we have premium plan also, that is of 12 months. It is of 50,000, in which you will get pre-recorded classes, live classes, live doubt clarification, one-to-one personalized guidance, notes, quick revision, examination module. For 20% instant discount, you can use my code Aanchal20. Then till we have covered the topic stomach, and today we are having the class over liver. So this is the clinical case scenario, but this will be discussing after the completion of this topic. So as we know, liver is a dual organ, right? Having both secretory and excretory function. So it is the largest gland in the body, weigh about 1.5 kg. Okay, so talking about its location, so it is located in upper and right side of the abdominal cavity, right? So it is located upper and right side of abdominal cavity. So why it is a dual organ? Because it is having both excretory as well as secretory functions. So liver and gallbladder are accessory organ of digestion and absorption, but still they play a vital role in digestion and absorption of especially fats, because it secrete a product, a very important product, that is known as bile, and bile is used for the emulsification of fat, right? So besides this, liver play a vital role in metabolism, hemopoiesis, immunity, clotting, bile formation, essentially an organ that maintain homeostasis, whereas the main function of gallbladder is to concentrate bile. So how the concentration of bile will occur inside gallbladder, that's all also we're going to learn in today's class. So as we know, the liver has dual functions, right? Secretory as well as excretory. It is the largest gland in the body, weigh about 1.5 kg. It is located in upper and right side of the abdominal cavity, immediately beneath diaphragm. It is made up of many lobes called hepatic lobe, and each lobe consists of many lobules called hepatic lobules, and hepatic lobules are made up of liver cells that are known as hepatocytes, right? So basically the liver is made up of many lobules. Okay, so these lobules are known as the liver is made up of many lobes called hepatic lobes, and each lobe consists of many lobules, that is known as hepatic lobule, right? So now each lobule is hepatic lobule is the structural and functional unit of liver. Okay, so basically there are about 50,000 to 1 lakh lobules present inside the liver. Okay, so 50,000 to 1 lakh lobules present inside the liver, and the lobule is basically a honeycomb-like structure, and it is made up of cells, and those cells are known as hepatocytes. So these are the basic morphology and basic things about the liver. Then next we have the hepatocytes. So basically hepatocytes are arranged in column which form the hepatic plate, and each plate is made up of two column of cells, in which between two column of cells in between two column of plate, each plate lies a bile canaliculus. So as we can see in the diagram also, there are two plates, right? Hepatic plates. The one is here and the second one is here. And in the in between the neighboring plates, a blood space that is known as sinusoid is present. So as we can see, this is the synoid space. Then the synoid are lined by the endothelial cells, right? So here we are having endothelial cells, okay? And these endothelial cells has fenestrated pores also. This is an important thing. Pores also, fenestrated pores also. Then in between the endothelial cells, some spatial cells are also present that are known as Kupffer cells. So basically, Kupffer cells are the macrophages of liver that are responsible for the phagocytosis. And these cells made up the reticuloendothelial system. So as we can see in the diagram also, we have two plates here. There is a sinusoid space, and then we have these cells. These cells are known as hepatic cells, right? Okay. Now, what is portal triad? So basically, the portal triad or the canals are the canals surrounding each hepatic lobules. As we can see the diagram also, the triad are lined by perivascular fibrous capsule. Each hepatic lobule is surrounded by many portal triad. Each portal triad consists of three vessels. The first we have hepatic artery. As we can see in the diagram also. The second we have a branch of portal vein. And the third we have a tributary of bile duct, right? Now, branches of hepatic artery and portal vein open into this sinusoid. Okay. So, branches of hepatic artery, both hepatic and portal vein drain or open up into this sinusoid space. Okay. Now, sinusoid open into the central vein. So, as we can see, the sinusoid is open into the central vein, right? And the central vein impetied into hepatic vein. Okay. Now, the bile is secreted by the hepatic cell and impetied into the bile canaliculus. Okay, here. From canaliculus, the bile entered the tributary of bile duct, right? Bile duct from the canaliculi of neighboring lobules unite to form a small bile duct, and these small bile duct join together and finally form the left and right hepatic duct which emerge out of liver. So as we can see from this diagram also, so basically what happens here, we have the intralobular bile duct. Then from intralobular bile duct, we have interlobular bile duct. Then it forms right and left hepatic duct. Finally, both right and left hepatic duct form hepatic duct. Then we will have common bile duct. Okay. So this is all about the ducts and the processes which occur inside the liver for the secretion of bile. Now the route of bile secretion. So as we have discussed, from canaliculus, the bile entered the tributary of bile duct, and tributary of bile duct from caniculi of neighboring lobules unite to form small bile duct, and these small bile duct join together and finally form right and left hepatic duct, which emerge out of liver. So now talk about the some things that are very important about this biliary system. So as we know that biliary system or extrahepatic biliary apparatus is formed by gallbladder and extrahepatic bile duct. As we can see in this diagram also, here we have the right hepatic duct and left hepatic duct, then both are forming the common hepatic duct, right? So now right and left hepatic duct, uh, which comes out of liver to form the common hepatic duct, it unites with cystic duct from gallbladder to form the common bile duct. So as we can see, this hepatic duct joins with this cystic duct, and now together they are form the bile duct, right? Now, common bile duct unites with pancreatic duct of to form the common hepatopancreatic duct or ampulla of Vater, which opened into the duodenum. And this is also controlled by a very important sphincter that is known as sphincter of Oddi, and this is also controlled by the or regulated by the stimulation of cholecystokinin, right? Uh, Now, next we have, or another thing we have about the portal system also. So, first of all, we should know what is hepatic artery and what is the role of hepatic artery in the liver, right? So, hepatic artery arises directly from the aorta and supply oxygenated blood to liver. Okay. So, if I talk about the oxygenated blood is always supplied to the liver by hepatic artery, right? And if I talk about portal vein, so basically the portal vein is that vein which supply deoxygenated blood to liver. Okay, so deoxygenated blood to liver is supplied by portal vein. Right? So portal vein is formed by the superior mesenteric vein and splenic vein. So basically, this deoxygenated blood to liver is basically coming from the intestine, right? So it brings deoxygenated blood from stomach, intestine, spleen, and pancreas to liver, and blood from hepatic artery mixes with the blood from portal vein in the hepatic sinusoid. So as we can see in the hepatic sinusoid, the blood from both hepatic artery and portal vein is coming, and the both the type of blood will get mixed here, right? Now the hepatic cell obtain oxygen and nutrients from the sinusoid, right? Now talking about the hepatic vein. Now as we can see, the blood from the sinusoid will drain into central vein, and from central vein it will drain into the hepatic vein, okay? And from this hepatic vein, finally the blood will again go to inferior vena cava, and from inferior vena cava it will enter into right atrium, right? So hepatic mean basically the substance synthesized by hepatic cells, waste product and carbon dioxide discharge into this sinusoid, and sinusoid drain them into this central vein, and from the central vein it will drain into hepatic vein, and from hepatic vein it will again go into heart for the oxygenation of the blood. So I hope the whole concept is very well clear to the students. So now blood supply to liver. So basically liver receive maximum blood supply of about 1500 ml per minute, and it receive blood from two sources, as we have already seen. The one is the hepatic artery, which bring oxygenated blood to liver, and the second is the portal vein, which bring deoxygenated blood to the liver from intestine, stomach, spleen, right? Now, next we have a very important topic, that is enterohepatic circulation. Okay. So, as we can see in the diagram, here we have a very important organ, that is liver, and here we have intestine, or first part of intestine, that is duodenum, right? So, basically, enterohepatic circulation is the transport of substances from intestine to liver through portal vein. So, as we can see, the transportation is occur through portal vein, right? And about 90 to 95% of bile salts from intestine are transported to liver through enterohepatic circulation, and remaining 5 to 10% of the bile salts enter large intestine. Here the bile salts are converted into two products. The one is the deoxycholate, right? And the second we have lithocolate, right? And the both are excreted into the feces. Clear? Now, the very important topic, the major function of the liver, and this question often asked in the university exams also. The question will come like this, that state the major function of liver or describe the major functions of liver. So first we have the metabolic function. Okay, so as we know, liver is the organ where maximum metabolic reactions occurs, such as metabolism of carbohydrates, protein, fats, and vitamin, and many hormones are carried out. So obviously, if metabolic activities are here, so there will be production of heat also. So another function will be production of heat along with the metabolic activity, right? Then next we have the storage function. So as we know, the many substances like glycogen, amino acids, iron, folic acids, vitamin A, vitamin B12, and D are stored inside the liver. So we know that glycogen are stored, and whenever we again need the energy, so it will again get converted into glucose, and then it can be reused by the body. So these are all the substances which are stored by the liver. Next, we have the secretion of bile. So as we know, the cells of the liver secretes a very important substance that is also responsible for the emulsification of fats, and that is bile. So liver secretes bile, which contain bile salts, bile pigment, cholesterol, fatty acids, and lecithin. Next, we have the synthetic function. So as we know, liver produces glucose by the process that is known as gluconeogenesis. It synthesizes all the plasma protein and other protein except immunoglobulins. So immunoglobulins are not synthesized by liver. Then such as clotting factor, complement factor, and hormone binding protein are synthesized by the liver. It also synthesizes some steroids, somatomedian, and heparin also. Then next function, we have the excretory function. So as we know, the liver excretes cholesterol, some bile pigments, heavy metals, toxins, bacteria, virus like that of yellow fever in case of jaundice, and through the bile. Then as we have discussed, the various metabolic activities occurs inside the liver. So the another function will be heat production, right? So enormous amount of heat is produced in the liver because of metabolic reactions. So the another function will be the heat production. Then we have the hemopoietic function. So as we know that in uterine life, intrauterine life of fetus, in basically second stage, right? From fourth semester to fourth month to 6th month, there will be production of RBC inside the liver. So basically, liver is also responsible for production of RBCs in intrauterine life. Then it's also store vitamin B12 necessary for erythropoiesis, and iron necessary for the synthesis of hemoglobin. Then liver produces a very important hormone, that is thrombopoietin, that is basically responsible for the production of platelets, thrombocytes. Then hemolytic function is also there. So the senile RBCs after a lifespan of 120 days are destroyed by the reticuloendothelial cells, that are basically Kupffer cells that are present inside the liver. So another function is this. Then the last function we have the defensive or detoxification function. So as we know, the liver has a very important function, that is detoxification of substances or toxins which are harmful for the body. So reticuloendothelial cells or Kupffer cells of the liver play an important role in the defense of the body. Detoxification in liver occur in total destruction of the substance by means of many metabolic degradation that also occur inside the liver. So here we have discussed almost all the important function that are occur inside the liver. So again, I'm giving you a brief about the function of liver. So first we have seen the metabolic function, in which we have seen the many metabolic activity and reactions occur inside the liver, in which it includes metabolism, carbohydrates, protein, fats, vitamin, and many hormones are also carried out. Then we have the storage function. Many substances like glycogen, amino acids, iron, folic acids, vitamin A, B12, and D are also stored inside the liver. Then there is a secretion of many substances that are very important, such as bile salts, bile pigment, cholesterol, fatty acids, and lecithin. And all the substances are very important for various mechanisms that occurs inside the body. Then we have the synthetic function. As we know that liver also produce glucose by gluconeogenesis, and it also synthesize all the plasma protein, but antibodies are not synthesized by the liver. Clotting factor, complement factor, and hormone binding proteins are synthesized by the liver, and some steroids, somatomedian, and heparin also formed by the liver. Then excretory function, as we know, it excretes cholesterol, bile pigment, heavy metal, toxins, bacteria, and viruses are also excreted by the liver with the help of macrophages or with the help of Kupffer cells. Then anamorous heat is also produced due to various metabolic activities that is carried out inside the liver. Then as we have seen in the intrauterine life of fetal life, basically in second trimester, what happened in the RBCs are produced inside the liver and spleen, and it is also responsible for storage of vitamin B12 for erythropoiesis and iron, which is necessary for the synthesis of hemoglobin. Then it also produced a very important hormone, that is thrombopoietin, which is responsible for the production of platelets. Then Kupffer cells are responsible for the destruction of RBC after 120 days. Then also the liver provides or perform defensive and detoxification, basically to eliminate the foreign particles or toxins or the substances which are very harmful for the body, right? Now, next we have the properties of bile. Yes, so as we know, the volume of bile is secreted per day is approximately 800 to 1200 ml per day. The nature and reaction is alkaline, and the pH is about 8 to 8.6, right? And the specific gravity lies between 1.0102 to 1.011, and the color is golden yellow or green, right? Now coming to the composition of bile. So as we know, the main components of bile, the first we have water and the second we have solid. So water is basically, bile contain 97.6% of water and 2.4% of solids. So in solids, we have both organic as well as inorganic. So the organic substances are very important, as it has bile salts, bile pigment, cholesterol, fatty acids, lecithin, and mucin. But in inorganic, we have sodium, calcium, potassium, chloride, and bicarbonate ions. Now, as we have already talked about the enterohepatic circulation, so it is the transport of substances from small intestine to liver through portal vein. 90 to 95% of bile salts from intestine are transported to liver, and 5 to 10% of the bile salts enter large intestine. Here, the bile salts are converted into two products, as we have discussed, deoxycholate and lithocholate, which are excreted in feces. Then we have the very important functions of liver bile salts. So, as we know, the bile is secreted by the cells that is known as hepatocytes, right? So the initial bile secreted by hepatocytes contain large quantity of bile acids, bile pigment, cholesterol, lecithin, and fatty acids. Then from hepatocytes, bile is released into canaliculi. From here, it passes to the small ducts and hepatic duct and reaches the common hepatic duct, right? Then sodium bicarbonate are added to bile when it passes through the duct, and these substances are secreted by epithelial cells of the ducts. Addition of sodium bicarbonate and water increases in the total quantity of bile. Now discussing the very important functions of bile salts. The first we have the very important function, that is emulsification of fats. So basically, emulsification is the process in which the fat globules are broken down into minute droplets or very small droplets and made in the form of milky fluid. So basically, this is known as emulsification that occurs inside the small intestine, and all these process occurs with the help of bile salts, right? So unemulsified fat usually passes through the intestine and it is eliminated in feces. And emulsification of fat by bile salts needs the presence of lecithin from the bile also. So as we have seen that in the composition of bile, there is a presence of very important substance, that is lecithin, right? Which is essential for the emulsification of fat. So now next we have the absorption. So again, the bile salts help in the absorption of fats also. So bile salts combine with fat and make complexes of fats known as micelles. Now the fats in the form of micelles can be absorbed by the small intestine very easily. Then we have the cholinergic action. So basically, bile salts also stimulate the secretion of bile from liver. Then we have the collegial action. So bile salts causes contraction of gallbladder and releases bile into the intestine by stimulating and the secretion of very important hormone that is known as cholecystokinin. Right? Then we have the laxative action. So basically, laxative is an agent which induces defecation. Okay, so defecation is the process basically in which there will be removal of waste product from the last part of the GI tract, and the bile salt act as a laxative by stimulating peristaltic movement of the intestine. That movement is known as ostration. Then the prevention of gallstone formation. Now, how the bile salts will help in the will help or will prevent the formation of gallstone inside the gallbladder. So what happens? Bile salt prevent the formation of gallstone by keeping the cholesterol and lecithin. See, both cholesterol as well as lecithin in solution form. Okay, now what happened in absence of bile salts? So in the absence of bile salts, cholesterol precipitates along with lecithin and form gallstone, right? So in the absence of bile salts, what will happen? There will be formation of gallstone, right? Now talking about the bile pigments. So as we know, the bile pigment are the excretory product in bile, and bilirubin and biliverdin both are the major bile pigment which are present in the human being. Now what happened? It formed during the breakdown of hemoglobin, which is released from the destroyed RBC in the reticuloendothelial system, right? So what happened whenever the lifespan of RBC will be completed, 120 days are completed, so there will be breakdown of RBC and there will be ejection of hemoglobin, right? So from this hemoglobin, there will be formation of bilirubin with the help of various enzyme, and this bilirubin is basically whenever it is present in the free form, right? So this bilirubin will enter inside the liver, okay, and there the conjugation will occur, and then the conjugated bilirubin will enter the small intestine. so that the emulsification of fats can be occurred, right? And also from small intestine, some part of this get eliminated in the form of stercobilinogen with feces, right? And another thing, some is converted into urobilinogen and excreted in urine. Okay, so these are the very important thing you should remember. Then, as we have discussed, the function of bile will be same as the function of bile salts. The digestive function we have discussed, absorptive function, laxative function, choleratic function, prevention of gall stone formation with the help of cholesterol or lecithin. Then collegial function we have discussed. Then the another function is maintenance of pH in GI tract, right? So as bile is highly alkaline, so it neutralizes acid chyme which enter the intestine from stomach. So as we know, the food that is received from the stomach is mixed with HCl. Okay, so for the neutralization of food, which is basically acidic, the bile is present which neutralize the acidic chyme or acidic food, right? Then we have the antiseptic action. So bile inhibits the growth of certain bacteria in the lumen of intestine by its natural detergent action. Then also the mucin which is present in bile act as a lubrication, and it is helpful for the motility of the food inside the intestine. Then we have another organ which is very important, that is gallbladder. So as we know, bile secreted from liver and it is gets stored inside the gallbladder. The capacity of gallbladder is approximately 50 ml. The gallbladder is not essential for life, and whenever any condition arises, such as tumors are present or stones are present, so in that condition, the gallbladder can be removed, and its removal is known as cholecystectomy. Basically, it is done in the patient who are suffering from gallbladder dysfunction also. And after cholecystectomy, patient do not suffer from any major disadvantage. In some species, usually the gallbladder may be absent too. Now, talking about the function of gallbladder. So, the first we have the storage of bile, right? So, the bile is continuously secreted from the liver and it is released into intestine only intermediately, and most of the bile is stored in gallbladder till it is required, right? The another function we have concentration of bile. So basically the bile is concentrated while it is stored inside the gallbladder. So the mucosa which is present inside the gallbladder rapidly reabsorb water, electrolytes, right? So rapidly absorb water and some electrolytes. But the bile salts, bile pigment, cholesterol and lecithin are not reabsorbed. So the concentration of these substances is in bile basically increased up to 5 to 10 times. Okay. Then we have the alteration of pH of bile. So basically the pH of bile decreases from 8 to 8.6 to 7 to 7.6, and it become less alkaline whenever it is gets stored inside the gallbladder. Then the last function we have the secretion of mucin, right? So gallbladder secretes mucin and adds it to bile. When bile is released from the intestine, mucin acts as a lubricant for the movement of food inside the intestine. So these are the very important and essential function that is performed by the gallbladder, right? So next we have the difference between hepatic bile and gallbladder bile. So as we have discussed, hepatic bile is the bile which is secreted by the liver, directly secreted by the liver, and gallbladder bile is the bile when the bile gets stored inside the gallbladder. So bile produces by the liver and the bile stored inside the gallbladder. flows into the gallbladder for the storage in absence of food, then secreted into the small intestine in the presence of food. So whenever food come into the small intestine, there will be secretion of bile from the gallbladder, readily secreted form of bile from the liver, and it is the stored form. It is not concentrated, but whenever it is present inside the gallbladder, as we have discussed, it got concentrated. Hepatic bile is alkaline, and the gallbladder bile is slightly acidic. So as we have discussed, the pH of bile get decreased whenever it gets stored inside the liver. Then it enters the common bile duct through the left and right hepatic duct, and it enters the common bile duct through the cystic duct. Then, as we have discussed, the pH get decreased, the specific gravity get increased because it get concentrated. The water content also get decreased, the solids get increased. So these are the major difference which occur between liver bile and gallbladder bile. Now, the very important clinical condition we have, that is jaundice. Okay. So as we know, the jaundice, or the another name for jaundice is icterus. So it is the condition that is characterized by yellow coloration of the skin, mucous membrane, and deeper tissue due to increased bilirubin level in blood. Now, the normal serum bilirubin level is 0.5 to 1.5 mg per deciliter, and jaundice occur whenever this bile exceeds more than 2 mg per deciliter, right? So now talking about the classification of jaundice. So the jaundice is classified as prehepatic. The second we have hepatic. The third we have post-hepatic, right? So as the name suggests, prehepatic means before going into the liver. Hepatic means whenever it is present in liver. Talking about bile right now. And post-hepatic means when it get emerge out of the liver, when it is not present inside the liver. Okay. Now, the causes is present in its another name. Okay. So prehepatic means hemolytic jaundice, the another name for prehepatic. This is hepatocellular, and this is obstructive. So these all are the name which are given to these types of jaundice on the basis of cause, right? So hemolytic means breakdown of RBCs, right? So whenever there will be excessive breakdown of RBC, so there will be formation of more and more bilirubin. So it will cause more increased in the concentration of bile. Then next we have hepatic or hepatocellular. So whenever there will be any kind of disorders present in the hepatic cells due to any infection or due to any disease like hepatitis, there will be sudden increase in the concentration of bile inside the blood. Then post-hepatic is another name for post-hepatic is obstructive. So whenever any kind of obstruction present in the biliary tract, so in that condition, the post-hepatic jaundice occurs, and it could be due to presence of any tumor or stone. Okay. So bilirubin also, we know that two types of bilirubin are there. The one is the unconjugated. The second is the conjugated, right? Means the one is the water soluble and the second is the water insoluble, right? So in case of prehepatic, as we know, the conjugation of bilirubin occur inside the liver, but in prehepatic, the liver not get conjugated. So there will be increase in unconjugated bilirubin. In hepatic, both will increase, conjugated as well as unconjugated, and in post-hepatic, only conjugated bilirubin get increased, right? So it is the condition which is characterized by yellow coloration of the skin, okay, and mucous membrane. You have to remember this is a very important symptom of this disease. So we have a very important clinical scenario also over this. So, a 45-year-old male present to the emergency department with complaint of yellowing of the skin eyes for the past week, right? So, yellowing of the skin and eyes. Okay. He reports dark colored urine and clay colored stool. He denied any recent travel, alcohol consumption, or exposure to hepatotoxins drugs. Now, he has a history of type 2 diabetes and hypertension, which additional symptom is most commonly associated with obstructive jaundice. Now, I'm giving you 30 seconds to answer this question. Please read all the symptoms that I have told you. These all are the very important one. Yellowing of the skin and eyes for the past week. Yes, the answer is C, jaundice, worsening with fasting. Now, next we have the another clinical condition, that is hepatitis. So basically, the hepatitis is the inflammation of liver characterized by swelling and inadequate functioning of liver. Hepatitis may be acute or chronic, right? And in severe condition, it may lead to liver failure and death also. Okay. Now we have the various causes of this disease, in which the first is the very important one, due to viral infection also it can occur, due to bacterial infection also. So basically always remember, itis means inflammation and hepatic we use for liver. So inflammation is in liver is hepatitis. Okay. Okay, now hepatitis is the liver damage caused by many agents. It is characterized by swallowing in inadequate functioning of liver, and it can be acute or chronic. In severe condition, it may lead to liver failure and death. Now, the features of hepatitis are fever, nausea, vomiting, headache. Chronic hepatitis, in it can include stomach pain, paleness, dark colored urine, and pale stool, and jaundice also. Now, the next we have cirrhosis of liver. Cirrhosis of liver refers to inflammation and damage of parenchyma, basically the tissues of liver. It results in degeneration of hepatic cells and dysfunction of liver. Now, the features will be again fever, nausea, and vomiting. Jaundice will be there. Increased heart rate, cardiac output, portal hypertension will be there. Hypertension means there will be increase in the blood flow. Then muscular weakness and wasting of muscles, drowsiness, lack of concentration, confused state of mind, coma in advanced stages can be there. Then gallstone. So gallstone is a solid crystal deposit that is formed by cholesterol, calcium ion, and bile pigment in the gallbladder or bile duct. Cholelithiasis is the condition in which there is a presence of gallstone inside the gallbladder, and cholelithiasis is the presence of gallstone inside the bile duct. Now, formation of gallstone, normally cholesterol present in the bile combines with bile salt lecithin, and which make the cholesterol soluble in water. But under some abnormal condition, this water soluble cholesterol precipitate and resulting in the formation of gallstone. Then the diagnosis can be done by ultrasound, scanning, and cholecystography. And the cholecystography is the radiological study of biliary duct after the administration of a constant medium. And the common feature of gallstone is the pain in stomach area or in upper part of the belly under the ribs. The other features includes nausea, vomiting, abdominal bloating, and indigestion. So the treatment, simple cholesterol gallstone can be resolved over a period of 1 or more 2 years by giving 1 to 1.5 gram of deoxycholic and acid daily. This increases the concentration of bile acid, so excessive concentration of bile does not occur. In severe conditions, the gallbladder has to be removed, and that removal is known as cholecystectomy, and laparoscopic surgery is also the common method that is also used for the removal of gallbladder. Now the summary, as we have discussed the major function of the liver, the first we have bile production, the second we have storage of many things like glycogen, fats, vitamins, then nutrients interconversions are also there. There's amino acids to energy producing compounds, and hydrolation of vitamin D also occur. Then detoxification also occur inside the liver. The phagocytosis also occur with the help of Kupffer cells, and synthesis of many substances like albumin, fibrinogen, and globulin, heparin, clotting factors are also occur inside the liver. Then at last, we have some questions for the students. One by one, I'm going to ask you. So, which of the following is the correct flow of bile from the cells to the duodenum of the small intestine? I'm giving you 30 seconds to answer this.